South Carolina CARES, which stands for South Carolina Comprehensive Adverse Event Response System, is one of our many quality improvement projects in South Carolina under our Every Patient Counts partnership. We started this a couple years ago, built off the model from the University of Illinois Chicago with their 7 Pillars program, where we were looking to bring together a group of diverse hospitals to test a system where we have a much more responsive system for identifying adverse events, investigating those events, having open and transparent communication with patients and families when harm occurs, and then using that as an opportunity to provide full disclosure to those patients and families when that harm was due to a medical error, and then using that information to make improvement efforts to hopefully prevent that particular error from occurring again. Everyone has a voice. It's not no blame, but what it basically says is the recognition that almost all errors are due to system and process failures, not to individual error. And so that individuals feel safe to report and safe to have that kind of communication that needs to occur so we can make improvements to avoid that type of harm event from occurring again. I mean, one of the big problems we have in the healthcare system today is that most people at the front line do not feel safe to report. Their concern is there'll be retaliation, that they may jeopardize their job. And a key part of the just culture is knowing that it's fair, that they have an opportunity to report, and even if harm occurs, there's a way to look into that more closely. And again, most often it's due to a system or process failure and not to that individual. We actually had patients involved in developing this program and on our leadership team, and what we've been able to do is do some early stage investigation in the fact that patients and families deeply appreciate this kind of open communication and with full disclosure, the opportunity to address the issue immediately. And most patients, what we've been found out over and over again, just want that kind of open communication, want to know what happened, want to be assured that they'll be taken care of as far as any kind of care they need after the harm event, and also that the hospital will do everything possible to prevent that from occurring again with another patient. Well, we found we actually had a group of 10 hospitals that piloted this, and it was everything from small critical access hospitals with 25 beds to large 750-bed academic centers, is that there were not a lot of, the systems were fragmented, there was not good processes in place to do quick identification when harm occurred, and even when a near miss occurred, and there were not good systems in place for communication, and we feel like we have tried to create a just culture. That's the platform that we work off of in each of these hospitals, and provided a much better system for them to do those investigations and also be much more open in their communication with patients and families.